Hello folks, this is the week 3 assignment for integumentary physical therapy, and it involves video recording of my assignment. We'll start with wound tracing. Here is the wound tracing. I use it from the textbook. Here is the wound right here, and I have traced the wound surface on the baggie here. Okay, in the top right corner there is a date, name, initials of the patient, clockwise orientation, length is 9 o'clock and 3 o'clock, and the width is 1 o'clock to 7 o'clock. The surface area calculation is right on the bottom, right here, and this is the longest length of the wound and longest width of the wound, which is respectively 4.6 multiplied by 3, which equals to surface area of 13.8 centimeters squared, which I measured using the trace marking here. Okay, this is the centimeter. So this is the length of the wound, which comes to approximately 4.6 centimeters, and the width is approximately 3 centimeters. The surface area calculation is done using these markings here, which is, as I mentioned, it's about 13.8 centimeters squared. Just showing you to scan the wound. In addition to that, I've also marked the wound markings. That is, M stands for muscles, N stands for necrotic tissue, B stands for bone, and this is the margin of the wound. I took this picture from the textbook, as I mentioned. So this was the wound tracing and surface marking. Now I would start with shaving and paring process. The technique involves using the scalpel blade number 10. I'm using the third web space, and my fingers are curling around the scalpel margins right across, right at the junction of the scalpel blade and the shaft of the scalpel. I'll be using the blade to do a shaving and paring process. Now initially the blade is kept at an angle position, and then gradually, to cut the wound, it just slides down close to horizontal. So I'll be demonstrating this. Now the things which we have to take care of is to make sure that we are not cutting through the viable white tissues of the orange, and I'm not using the ham hog because of particular reasons. I'm using the orange, the navel orange, and I'll be demonstrating all the procedures on the orange. So I'm starting with shaving and paring process, which basically shaving can be used for callus shaving and paring. My hands are supported, and I'm sliding through the superficial tissue, making sure that I'm not cutting the deep tissues. The forearms are supported, and the most of the movement is coming from the wrist and the fingers, the sawing motion. Very thin tissue, very transparent. trying to make sure that I don't cut very deep, so to cut the viable tissues, and going very superficial. I'm also using just the curved part of the scalpel, not using the tip of the scalpel, just making sure. So this is the area which I'm shaving off. These are some of the flakes. Let's try and demonstrate the thin flakes here. Yesterday I was practicing on an orange, and I made a couple of deep wounds which shows the white meat aspect of the orange, and this is compared to maybe some progress today on the orange. This is today's orange, and this was one I used yesterday. And the blade I was using is number 10 blade. I'll be shifting to cross hatching or scoring technique, and I'll be using number 15 blade, which is a little sharper and shorter than the number 10 blade, and has a very thin and small edge, the blade. So for this I'll be using a pencil grip. I'll be putting the shaft right on my first web space, and I'll be curling my fingers like a pencil and very close to the separation of the scalpel blade and the shaft of the scalpel. The other thing I'm making sure is I'm going to use the curved edge of the scalpel and not the tip of the scalpel. So just going to demonstrate my grip here. It's not moving here, very steady, and just gripping the edge of the shaft so I don't cut my fingers. So for cross hatching, I'll be making 3 cuts, just deep enough but not too deep to injure the viable tissue, using the pencil grip, number 15 blade, my hands are supported. I'll be demonstrating how deep I went. This might give you an idea. Using the curved edge of the scalpel, not going to 3. This is 3 horizontally, and the other 3 is going to be vertical. I think I just did a little deeper cut this time. Try and demonstrate. It does not have a die, so it might be a little difficult to see. Just gonna demonstrate again using the pencil grip, making sure to use the curved edge of the scalpel rather than the tip. In a tic-tac-toe fashion, 3 vertical and 3 horizontal. Now, I was trying the cross-hatching technique yesterday. It was a little deep, and I think I improved over yesterday, and just getting a good grip of the scalpel and putting good cuts throughout the orange. So this was the cross-hatching technique. Now, for the purpose of debridement, sharp debridement, using the scissors and the forceps, I'll be again using the orange. I've dyed it using a green dye, which closely resembles my wound tracing here. Now, first, grip of the forceps. 2 different techniques. One is holding the forceps in the web space and using fingers and thumb on the opposite direction to grip the scalpel. And other technique is to grip scalpel in the palmar surface and just using the finger and the thumb this way. Out of these two, I find this this method a little easier, probably because I like longer fingers maybe. I'll be using 2 techniques. So this is my orange, and I'll be using the mid portion of the orange, and the grip of the scissors is 3-point grip, using the finger on the shaft, and the ring finger and the thumb are the other 2 spots of contact. Scalpel grip. So I'm going to try and pick up the necrotic tissues here. For the scissors, I'll be using the inner 1/3 part of the edges so as to get the maximum power out of the scissor. I'll be demonstrating whichever tissues I cut and the orange when I finish. And the end of the scissor is not pointing downwards, it's always pointing upwards, so as I'm not cutting down throughout the tissue, throughout the viable tissue. Just picking up the tissues, keeping my angle upright. I found it a little difficult to keep my hands stable on the surface in this position, because probably the arrangement of the orange, and I might have to lift my forearm. I tried practicing putting my hands down, but the accuracy goes down if I do that. I'm keeping my hands fairly stable on the surface, just using the scissors and scalpel as much as needed, and making sure I'm not going too deep. Just pick up the tissues and cut through it using the scissors. For the purpose of demonstration, I'm just trying to keep the orange a little inclined towards the camera so we can have a better idea. The other technique to use is to use the palmer grip, using the finger and the thumb to kind of grip the tissues and cut through it. Again, I found it a little difficult to keep my arms rested, which might fatigue me easily because I'm keeping my shoulders and elbows up. I'm trying and cutting through the deep tissues here. I think I'm just went a little more deeper. I'm seeing a little orange tissues coming out, which suggests I went a little deeper last time. Which also suggests that I have reached sufficient depth in the tissue not to cut the viable tissues, and just pick up and debride the um, necrotic tissues. I'm starting to see some orange tissues underneath the tie, which suggests I should not go any more deeper. This is my orange after the debridement. There's some tissue still there in the green area, and you see these are the flakes. So this is the assignment video for week 3 for PD 804 Integumentary Physical Therapy. Thank you.